I call the 7th meeting of the Health Services Committee on March 14th, 2025 at 6 p.m. By the way, I wanted to make sure that the members know that we do have pizza that has been saved for us at the Capitol, so you will get to eat. All right. Do we have any guests joining us at the table? Nope. All right. All right. Very good. All right. Let me go ahead and have us call the roll.
Representative Bratcher. Representative Bray.
Present.
Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Dotson.
Here.
Representative Fleming.
Present.
Representative Gordon.
Here.
Representative Holloway.
Here.
Representative Marzian. Representative Neighbors.
Here.
Representative Proctor.
Present.
Representative Rayburn.
Here.
Representative Raymer.
Here.
Representative Riley. Representative Sharp.
Present.
Representative Wilner.
Here.
Vice Chair Duvall.
Here.
Chair Mosier.
I'm here.
All right. Representative Mosier, would you please introduce yourself for the record? Any guests that need to be at the table?
Okay, I'd be happy to. Thank you. I'm Representative Kim Mosier. I represent the 64th District, and I really appreciate the opportunity to be here. I'm sorry about that grand entrance I just made. But, yeah. So what we have before us is a committee substitute on Senate Bill 153.
Yes, so everyone should have that. It should have 25 RS SB 153/PHS2 and on there.
Okay. We need to adopt the sub.
Motion to adopt the sub. All right, all in favor say aye. Any opposed? All right, motion carries. Go ahead and
Okay.
proceed.
All right, thank you. The substitute that we have before us tonight deletes all of the original provisions of the bill that you have, Senate Bill 153. And in its place, we are adding the provisions of Senate Bill 14, which prohibits the discrimination by a pharmaceutical manufacturer against a 340B covered entity. And it will add a new section of KRS Chapter 216 to establish reporting requirements for the 340B covered entities. That is basically it. This provision on the protections will sunset after 1 year. It will allow us to take a look at the data by July 1st of 2026 and renew the provision. And we are also in this language, we will follow the federal guidelines in terms of what they decide if they make a decision to reform this program, because it is a federal program. If they make a decision to make any changes in the next year, that we will follow their recommendations if they reduce the program in some way. If they increase the provisions of the program, then it will come back to the legislature to make a determination as to whether or not we follow that. That is basically it. I know that it's you haven't had a long time to look at this, but I'm happy to answer any questions.
Any questions? Oh, Representative Burke?
Thank you. I understand the definition of contract pharmacy is different. Can you just briefly help me understand that?
Yes, thank you. Thank you for that question. What we are doing is simply aligning with the federal definition, and it was duplicative to have both definitions, so we're aligning with the federal.
Thank you.
You're welcome.
All right. Representative Wilner?
Thank you, Mr. Chairman. I have two questions. I hope I'll be able to get to both of them. The first one, and maybe this is unanswerable, there's a lot of change happening in the federal government, right? There's a lot of unpredictability right now. Is this a program that we have any reason, has anything been stated that we would expect this program to change?
So this program has a long history. It is a federal program. I can't remember if it was in the early 90s that it was established, but it allows pharmaceutical manufacturers to sell products, sell drugs to a hospital or a 340B entity. And there's a long list of, what makes somebody eligible to be a 340B entity. But if the manufacturer sells this drug at a low negotiated rate, then the hospitals or the 340B entity sells it to a contract pharmacy. It's a long it's a federal program that's been in place for a long time. So is your question, are we making changes to, we can't make changes to the 340B program.
No. I guess I'm just, we're hearing about there may be changes to Social Security, or there may be changes. Are we hearing anything to suggest?
There have been some proposed legislative proposals on a federal level for a couple of years. And so this is not brand new. I mean, the Congress and the Senate, there are two bills, unless there's something new, that are looking at program integrity. Are there guardrails that need to be put in place? How's this program working? And so really the reporting that we're requiring here will help the federal government make policy decisions as they look at possible reforms. They haven't said anything definitive, but they are looking at the program.
Thank you. May I ask one more question?
Absolutely.
Thank you. So I remember maybe at our last meeting, we had two bills that were discussion only, and one was Senator Meredith's bill, and he spoke very passionately about Kentucky hospitals just not getting our fair share, that we were eligible for dollars that we were not getting, that other states, I think Arkansas was mentioned, that they put this kind of law in place and then they started getting more money. And then we also heard that there's some problems with this program at the federal level. So I guess my question is, just at a really high level, is this basically saying we need to have reporting requirements because we need to understand how these federal funds are being used in Kentucky, but in the meantime, we want to make sure that we're not jeopardizing our rural hospitals?
You're exactly right. And that's exactly what we want to do with this. We want to keep those protections in place for hospitals, and if another state is getting these low negotiated rates, we want Kentucky to get them as well. So, yes.
Thank you.
Representative Bray?
Thank you, Mr. Chairman. I've just got a couple questions. On page 4, line 8, one of the reports that is requested is the total operating cost of the nonprofit hospital, including an itemized cost report for the following. When it says total operating cost, what exactly does that mean? I mean, is that the overall budget of all aspects, including maybe including outpatient services, or?
It's not really delineating outpatient versus inpatient. It doesn't, I think the way I'm reading this is it's the total operating cost of the hospital.
Okay.
An
itemized cost. Yeah, it's an itemized cost. And okay. And
right,
then,
there is an itemization after that, but line
Right.
8 is the total operating cost.
And that may be something they already have to report somewhere, and they can just pull that number.
I think so.
All right. And then on page 8, starting on line 18, 340B covered entities, it says they've got to have a written agreement in place to prevent duplicate discounts. What kind of discounts could be duplicated or?
Yeah, okay, thank you for that question, because they, Medicaid can also utilize, well, there are pharmacy rebates, and then there's the 340B program. And all of this is saying is that you can't use both. So, yeah, I mean, it's just stipulating what is already in regulations as far as what Medicaid can do.
Okay. Thank you, Mr. Chairman.
Representative Camuel.
Oh, thank you, Mr. Chairman. Actually, Rep. Wilner asked the question that I had, how we're comparing to other states, so it was answered. Thank you.
All right, very good. No other questions?
Mr. Chairman,
Yes, Representative Bratcher made a motion on the bill as amended by the sub.
I had a question.
You have a question? All right, we have a question.
Thank you,
Go
Mr.
ahead,
Chairman.
Representative Fleming.
Thank you. Chairwoman, thank you very much. I know I have a high respect for you, not only for your intellect, but also your passion for healthcare. I wanted to ask you in regard to the reporting. So the information will be gathered. Obviously, it seems like a total operating costs as well as itemized deductions or itemized accounting processes and the costs of services being provided. I guess particularly when it comes to the 340B. So we get this information. Okay, so there's transparency with this. What do you see down the road of what we're going to do? What we're going to do with this? I mean, what's the DMS going to do with this? What's the General Assembly going to do with this?
Thank you. This will be reported to the Cabinet for Health and Family Services as well as the Office of Data Analytics. And the office will provide, be able to look at the different metrics that are measured here and tell us whether or not, how much charity care is occurring, where it's occurring. We want to know the great things that are happening in our communities and how this is being passed along to our communities. And so, I think that there are several pieces of information that will be kind of noted through the reporting, and it depends on which part maybe you're asking about, but I believe we want to know how the program's working and how much money is being saved, and how the hospitals and the communities are utilizing the funds.
Let's come on, follow up.
Go ahead.
Thank you. All right, so we will find out information on how the Medicaid money is being allocated to various, various parts of the community or to the state. This might be an unfair question because it deals in analytics, and I know we're not talking about that. But part of my thought is that when you go through those analytics, will a significant amount of money, $50 or $100 million that goes into a particular area, will that be caught, incorporated into the analytics, in terms of that? So you have the costs of the income or the revenues, and then you have expenses and detail costs. My concern is, will that also include investments of $50 or $100 million into a community, like building a hospital, building a facility, and so forth? Mm-hmm. And I don't have a whole lot of security that will be included, where we will go back and make either some changes, or the DMS make some changes, or whatever.
We are, thank you for that question. We are asking for a narrative as well as the amount of money that's going into the community services. So I think it will be noted. I think that we'll be able to tell And you know, I mean, maybe this data reporting set is not 100% complete. We can come back next year and adjust it, and if it's not, if it's not everything that we need, or if it's more than we need, we can make those adjustments. But I do think it'll give us a picture of what is happening in the communities with the 340B savings.
And I understand, and I understand we can come back next year, but I know the first reporting period is going to be December 15th of this year. And then we will come back next spring for 2026 session and maybe do some adjustments. I don't know what. The federal government might be doing something, or they might not do anything at all. So I guess I just want to be conscious of, you know, this information we get will be useful, be put forth in a good light, but also includes all those other types of investments that these hospitals are doing. And I think we're all in agreement. We don't want the rural companies, rural hospitals to have any pushback, because they're on a thin, and I know some of them, they're pretty thin. So anyway, thank you, Mr. Chairman.
I agree.
Representative Gordon.
Hi, thank you. I just have a question of clarification. At the end of the first section, that's where the sunset provision is, and says the July 1st date we've been referencing, but the reporting is actually in section 2. So I just wanted to confirm, does the reporting sunset as well?
The reporting does not sunset. It's only these protections if we look at the data and just decide that, you know, this is there are, I don't know if they're out of compliance with some of the federal rules, but a lot of this is already being reported to the federal government, not in this great of detail, but there are audits and there are reporting metrics that they have to meet and, you know, share with the federal government.
Thank you.
Representative Sharp.
Thank you, Mr. Chair. I got a couple of questions, if you don't mind. Representative, has the Hospital Association had a chance to weigh in on this?
This is the identical language that we had in House Bill 685, so they are very familiar with this language. And we've had meetings, and they made a few recommendations, but when I went through it line by line, comparing their recommendations with what we were putting in here, there were some differences, but there were also a lot of similarities. So I feel comfortable that they know what's in here, and that the reporting should be at their fingertips, because this is a program that they've had in place for a long time.
So are they for this or against this?
They haven't been able to weigh in on this. They did not want the level of reporting that we had in 685, but we feel that it's important to have this reporting to share with the federal government when they're making decisions about their reforms, if they do that, and also to make sure that we really understand how this is benefiting our communities.
I've got two hospitals in the district I represent. One of them is very rural and not that well off of an area, and the other one is a bigger hospital in a bigger area and still not in a well off area. Is this going to hurt either one of those hospitals?
They should be able to report the numbers that they have, the cost savings that they, the benefit to their hospitals. But no, we're putting protections in. The Senate Bill 14 protections are in place for those hospitals. So they'll be able to continue to contract with outside pharmacies, and the program remains the same for them.
So if I'm understanding this bill right, the Senate Bill 14 sunsets in a year, but the House bill that you were sponsoring continues on indefinitely.
the reporting will continue because the program's not going to go away. But, you know, if the protections just say that it doesn't shut the program down if we don't have these protections, it just says that they can't continue, or they feel, I think the hospitals feel like they can't continue to use the program if they don't have, you know, if there's that the manufacturers aren't passing along these savings to them, that they're not going to be able to get these savings and to be able to use outside contract pharmacies. Does that make sense? I mean, that's why they feel like the manufacturers are not complying with the terms of the federal law currently, and that is why they want the protections in Senate Bill 14.
Thank you, Mr. Chair.
Representative Burke.
Thank you. I'm digesting as quickly as possible,
I
and
know.
a couple of my questions have been answered. So that leaves me with just one question, which is on the reporting requirements. I just want to confirm that this reporting only requires hospitals to report and not federally qualifying health center. Is that correct?
That's correct.
All right. Thank you.
Representative Neighbors.
Does this reporting go to anyone other than the cabinet?
It should also go to the Office of Data Analytics. I'm looking for where that might be.
Just wanted to know who besides the cabinet will get the data.
I don't know where Stephanie is. Oh, there you are. Thank you. Thanks.
Please introduce yourself for the record.
So I'm Stephanie Bates. I'm with the Office of Health Data Analytics here at LRC. I'm a nonpartisan employee. So the idea is that the bill would allow the information to come here to LRC to serve the General Assembly as well.
All right, very good. Representative Callaway.
Thank you. I was just wondering, since we are merging, what Senator Meredith, how he was feeling about this.
Oh, there you go. I have not had a conversation with Senator Meredith about this.
All right. We have a motion by Representative Bratcher. Do I have a second? All right. So the motion is passage of Senate Bill 153 as amended by the sub. DJ, please call the roll.
Representative Bratcher. Representative Bray.
Explain my vote, please.
Oh, yes, please.
I'm gonna vote yes, but there are some things in here I am concerned about. Representative Sharp brings up a good point. We are extending protections to these hospitals, but it sunsets in a year, and the cost that we're imposing on them doesn't sunset with the benefit. There's some things in here I don't understand. I don't know what my hospital has to report already. I do have a little bit of concern about reporting a total operating cost if that's not reported somewhere else in government, and I apologize. I probably should have asked Ms. Bateman that question earlier. Like I said, my hospital is the largest employer in my district. They don't bill Medicaid for 340B. They do everything right. I don't want to put something on them that's going to hurt them in the long run, but I'm going to trust the process, and I'll be a yes for now. Thank you.
Representative Burke.
I'd like to explain my vote.
Go ahead.
I also will be a yes today. This is something that I'm appreciative we've had conversations about, trying to merge these two pieces of legislation so that there are wins and losses on both sides. I do share Representative Bray's concern about the sunset being on the guarantees for hospitals of getting the maximum benefit, while the requirements for reporting are not sunsetting. But I hope that most of us will come back to the table next year to hopefully be able to continue that for the hospitals. And I'm grateful for the benefit this is going to have for the FQHCs in my district. So thank you. I'm a yes.
Representative Callaway.
Aye.
Representative Camuel.
May I explain my vote?
Go ahead.
Okay, I'm a yes today as well. I do have a number of hospitals as well as their ancillary adjacent, well, I guess they're adjacent clinics as well, and just want to make sure that I have an opportunity to talk with the folks over there to make sure they're good with it. But I appreciate this, and thank you for taking time to explain it.
Absolutely.
Representative Dodson.
Yes, may I explain my vote?
Go ahead, please.
I'm a reluctant yes for now because I think there could be some unintended consequences that we don't see, but I do trust the process here. So I believe we get it out of committee, that we'll have a chance to go to conference with it and work these things out. So today, I am a yes to get it out of committee, but I do see where there are some issues that maybe we need to work on. Thank you.
Representative Duval.
Yes.
Representative Fleming.
Explain my vote.
Yes, go ahead.
Thank you, Mr. Chairman. I'm going to pass. When I look at, and given my background, particularly when it comes to finance, and looking at and my experience in listening to Medicaid and DMS, I have a very discomfort with that group and that agency and going through that process. And when you look at, as Representative Bray said, you look at total operating costs, and then you have detail, itemized accounting processes and procedures and all that stuff. You're really opening up a can of worms, I think. I do appreciate the transparency, and trust me, I'd like to have as much transparency as possible, but I also got to be conscious of how far does government go in terms of transparency. I know there's a time limit on here when it comes to reporting, but then again, as I expressed before, this other half continues on. And looking at the data we'll get, I still don't have a high degree of comfort of what we're going to do with it. There's a lot of analytics that will go through here. I've mentioned it before, and I think the chairwoman, did a good explanation in terms of, hopefully that will be put into the calculation of what the investment and how much money they're, putting toward a particular community. But I'm going to pass right now. We'll see what's going on the floor. I might change my vote one way or the other, but I just want to say pass, and I do appreciate the opportunity for her to bring it here.
Representative Gordon.
I'm a yes with reservations.
Representative Holloway.
Yes.
Representative Marzian. Representative Neighbors.
Yes, but I'd like to reserve my right to change the vote on the floor.
Representative Proctor.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Can I explain my vote, please?
Go ahead.
Thank you, Representative Moser, for your hard work on this legislation. I have major concerns with the 340B program at its core, with what's being done with the profits, what it's doing to our overall drug costs for consumers. But the piece that you've added about the reporting, the data that we would collect, makes it much more palatable to me. The sunset provision also helps me, so I'm going to be a yes today. Thank you.
Representative Riley. Representative Sharp.
Explain my vote.
Go ahead.
I'm going to pass today. I've got some concerns about part of this sunsetting, the other part not sunsetting. Plus the issues that Representative Bray has spoke about. There's just a lot going on. I'm going to pass.
Representative Wilner.
I'd like to explain my vote.
Go ahead.
Thank you. I had told some people before that I was likely to be a yes on this pending reading the bill, which I've now had time to do, and hearing the discussion. I'm gonna keep my word, and I'm gonna be a yes for now. But I have to say I've heard some things here in this discussion that have really given me pause, and that I need to look into some more and understand better. And I also got a text from a friend who works in rural healthcare. Did not know that they were watching the KET broadcast, but texted me and said this is going to kill rural healthcare, and I need to understand what that means. So I'm going to keep my word and be a yes for now, but I don't know that I'll be a yes on the House floor. Thank you.
Chair Mosier.
Yes.
Senate Bill 153 with House Committee Sub 2 passes with favorable expression. We do have a title amendment. We need a motion. We have a second? All in favor? Aye. Are any opposed? Very good. Motion carries. There being no other business before us, motion for adjournment. We have a second? All right. Very good. We are adjourned.